everyone who's joined us. Welcome to the third webinar in our COVID-19 series. Today we're focusing in on how Save the Children is protecting a generation from children from the impacts of COVID-19. And we've got a particular focus on keeping children safe today. I'm Amanda Morgan. I'm the Director of Humanitarian Response Fundraising, and I'll also be your host today. First and foremost, I want to thank you for joining us and listening to us as we talk about what we do. Our donors and our partners on the line, we've said it before, you've been by our side during the biggest humanitarian crisis we've seen in 101 years of our history. For those of you who are new, thanks so much for joining us today and getting to know us a little bit better. We're really looking forward to updating you on our vital child protection efforts. To do that, we're fortunate enough to have two of our experts here to share their insights. We have Amy Richmond. She is the Director of Child Protection for our international programs. And we have Amanda Azali. She is the Children on the Move Child Protection Regional Advisor in West and Central Africa specifically. Before we get started, you all are probably Zoom experts by now, but just so you know, we want to cover the logistics to ensure that you can participate with us. Please note that everyone's line is muted and we're recording the call, so we'll be able to share it out with you and you can forward it on afterwards if you like. If you want to ask a question, please do. You can type in the chat box. If you're not online, you can actually email during the conversation. You just need to email events@savechildren.org and we'll be sure to get to your question. While we're talking, please feel free to type in your question. You don't have to wait till the end. And we have colleagues on the line here to help with chat box management so we don't miss any of the questions as we have the conversation. So I don't want you to have to listen to me too much. We'll actually go into our speakers right away because I know we don't have that much time. Save the Children is proud to say that we've been able to continue delivering child protection programs for children during the course of this pandemic. That is not to say though that we continue to operate the same old ways as we did before COVID. Our staff, the networks of community partners, the volunteers that work with us, they've really innovated in new ways to deliver services safely and effectively as we've had to adapt. In short, it's safe to say that we have not stopped doing our jobs as we've seen increases to risk to children, both physical and emotional, as a result of this pandemic increase. So it's more important than ever that we talk about child protection and that we continue. So I'm going to start with Amy, if you don't mind. I think that you can give us a great picture kind of at the macro level and share a bit about what you're seeing as the problem. What are these risks to kids as we talk about risks increasing? So what are those risks now that COVID-19 is really taking a hold across the whole globe? And then if you could just give us a sense and really hone in where Save the Children is particularly focusing on, because there's a lot of child protection programming that we do, but globally, what is it that we're seeing is most critical at this point in time to make sure that we get right? So Amy, do you mind just starting us off?
Sure. Thanks, Amanda. And thanks to everyone who's joining us and supporting us in this critical issue, really at the heart of what Save the Children does. So as Amanda said, and as we all know, we are facing an unprecedented global protection and mental health crisis for children caused by disruption of routine and learning, disruption of protection services, and the increasing negative effects of the impending and current socioeconomic crisis. So we at Save the Children actually recently did a global study where we asked children and families that we work with directly what the impacts are on COVID-19. And while we're still analyzing and the data and haven't yet published the report, I did want to share some of the top protection issues that are kind of coming to the top with you today before I start talking about the response. So 1 in 6 children that we talked to told us that they did witness or experience violence in the home during lockdown. So this is either a child being hit or verbally abused, or them being exposed to a parent being hit or verbally abused. And we also know that women and young mothers and adolescents are disproportionately affected by domestic violence and are increasingly being isolated from their support networks. This reporting of violence was also inextricably linked to the psychological toll that the pandemic's taking on families. Parents directly told us that their stress increased as loss of income continued, as schools were closed continued, and that this led to an increase of violence in their home. Children also directly talked to us about their own mental well-being. Children told us, vast majority, over 80% of the children that we talked to said they increasingly were experiencing negative feelings as the pandemic went on. They told us that this was linked to them not being connected to their friends, not being connected to their teachers, and they told us in different ways that they weren't able to play the same way that they used to when they attended school or were out in their communities. We also know that there's been an increase of children separated by their families and unaccompanied, lost without the loving, caring, protective environment of a parent. We also know that there's been an increase of sexual and gender-based violence, with the UN reporting an estimated 30 million new cases in the next 6 months of lockdown. We've also estimated 13 more million young girls will be forced into an early marriage situation as families don't have anywhere to turn to face the socioeconomic crisis in their households. And in addition to that, we've seen an increase in online exploitation as children go increasingly online. And overall, the number that we can't turn away from is that 62 million children right now are facing to fall into extreme poverty. Some of them already have. That will push many of them into placements of the worst forms of child labor, living on the streets, and other exploitative situations. And all of this we see is compounded by the adverse conditions that children we work with already live through, like conflict, forced displacement, and migration. So what is Save the Children doing to respond to these issues? So as the world is racing to stop the spread of COVID-19, we are developing programs to mitigate the looming child protection crisis. And we are focusing on 3 critical dimensions of protecting children's safety and well-being, what we call the protective environment. So children are at the middle. They have their own ability and skills and opportunities to protect themselves, and then they are supported by their family and their community. So our child protection program looks at catalyzing each of these levels. And I say catalyzing is really important to us because we already know there's so much going on. Families and communities inherently want to protect their children. They love their children. They might just during these unprecedented times lack resources, lack skills or knowledge on how to keep them safe during a pandemic. So our program works with communities with our long history, as Amanda said, and knowing and working with and being a part of the communities to identify those gaps in resources and skills across these levels, and contextually, depending on where we work, adapting and filling in those gaps. So at the child level, we are working on community family tracing and reunification linked to health facilities. We are also mobilizing emergency foster and family-based care for children who have been separated from their parents due to illness and loss, or have been placed in negative situations like living on the streets, in early marriage, or in child labor. We are also working on for children to reduce and tackle misinformation and stigma around COVID-19 that places children at risk of discrimination and violence. It also puts them at risk of being rejected into their communities when they return. We're doing this by tapping into whatever media is available depending on the context, partnering with local radio, TV, community outreach to continue and initiate community dialogue. We're also including these messages in interactive radio instruction and remote learning opportunities. And everywhere where we're working, including protection messages. For children, we are also doing what we already know and adapting those programs, including structured psychosocial support programmings, making them available remotely. For example, HEART, which is stands for Healing and Education in the Arts. This is Save the Children's arts-based expressive arts-based program to healing for children who have experienced adversity or crisis. During COVID-19, we have worked rapidly to adapt this program to be remote so children can access it based on whatever technology is available to them, even including bringing art kits to home doors where there are low technology operations. So at the family level, we are supporting and providing parents and caretakers with the tools and resources they need to appropriately keep their children safe and comforted at home. This may include or does include access to remote programs directly for parents to reduce their stress and provide them with positive parenting skills, communication skills to interact with their children so it doesn't lead directly to violence. We're also linking families up to critical social welfare and social protection initiatives to reduce the economic shocks of the pandemic. And overall, in the family support programming, we are taking a mental health and psychosocial support lens because, as I mentioned before, the psychological toll is really linked to all of this. So we are focusing on and supporting families to interact with each other to help each other cope. For example, in Uganda, which is a low technology context, as soon as schools and child-friendly spaces were closed, our facilitators were equipped to go door to door safely and we provided them with safe tips, just written documents on tips, stress busters that parents could do with their kids, activities that parents can do with their kids, activities that kids can do alone or with their siblings. And we also provided them ways that they can connect to peers either using a phone, radio, or what other means they have available to them. And this just at the very basic level helps families and children continue interaction and reduce stress at the home. At the community level, we are also, one of the main things that we're doing is supporting child helplines. So we are also, when our communities go outreach, they're taking information on child helplines, and we're supporting the functioning on this to be the main reporting mechanism for incidences of violence and abuse. But as we support child helplines and we are seeing an increase in incidence rates around the world, we have to be able to respond to those incidences report appropriately. So we are therefore focusing on community-based child protection networks and child protection caseworkers to be able to respond in a contagious environment. So these caseworkers are very familiar with their communities. They know which children are at risk of violence and have already been following up on them. They respond to girls and women who have experienced and are survivors of sexual and gender-based violence and provide them through a case management process, the psychological and physical support they need. So Save the Children, in supporting our community networks and our case managers, we are providing them with PPE, we're providing them with technology and communication tools to follow up, and we're also providing them with knowledge and skills on how to appropriately take through child protection cases to provide appropriate support. This also, while they're able to go into the community safely, creates a network of supportive communities so that the community also knows which families are at risk of not being able to put food on the table and might place their children in harmful situations like child labor or early marriage because of that, and they can respond together as a community to either access support from Save the Children or problem solve together. So all of these activities we also are approached by using a gender-sensitive approach or a gender and social inclusion lens. This is key to our approach because Save the Children knows through past experience that infectious disease response, outbreaks, and other emergencies affect children different ways according to their gender. So for example, girls may be, based on their gender, asked to do more chores at home that could affect their learning. And in fact, in our study, 1 in 5 girls versus 1 in 10 boys said that they were doing too many chores to be able to continue their learning. The COVID-19 might affect boys disproportionately because they are, due to their status and their family, expected to go to work when income is lost, and then put in harmful situations and may never be able to return to school for that. But critically, the gender dynamics are threatening girls in a life-threatening, disproportionate way because of their risk in the increase of sexual and gender-based violence and domestic abuse that we're seeing, and the estimated number of girls that could be placed in early and forced marriage. But overall, we're taking a gender and social inclusion analysis at the beginning of each of our program implementations and ongoing throughout to identify in reality what are the issues and how to respond to them. So just to end this session or my little piece, I did want to make sure that I brought the voice, since we've been talking to children and families. Amanda, if you don't mind, I did want to bring the voice of the child to one of the girls that we talked to in our study, a young girl, age 11,
Yeah, please do.
Who lived in Kosovo. When we asked her, what do you want leaders and adults to hear? And she simply said, please pay close attention to the children. Throughout this time, we've only heard about the COVID-19 rules, and they've only increased the panic. They were also only dealing with political issues. No one bothered with our mental and physical health.
Wow, that's pretty impressive. And I think, that's one of the things that, I'm so proud of for working for Save the Children, is because it's not only, we're not speaking on behalf of children, we're raising children's voices up and asking them what they think, how they feel, what is their reality, and bringing that straight through. So Amy, thanks so much for bringing that today. There were some themes that I think that you presented that we'll explore a little bit more, that I know Amanda is actually going to speak to. One of them being child marriage, and I'll just reiterate what you said is, these parents love their children and they know how to take care of them, and we're there to nurture and support that. And nobody wants to see their children be put into harm or put them to work. And they are truly driven by desperation into those circumstances. And so I think some of what we'll talk about here is, how do we pull them back from that? How do we give them the tools and the resources, the financial resources, so they don't have to make that decision? So I'll end there, but thanks, Amy. And I think we can touch upon some of that on how we do that, some specific examples in a little bit. But I wanted to transition to Amanda because, Amy was able to give us this kind of macro global picture of what of these risks are, what are we doing? And thanks so much, Amanda, for joining us, because you're going to bring us into a little slice of the world, actually a big slice of the world, West and Central Africa. But it really to hone in and to bring to life, what is life like for children now in West and Central Africa, kind of as we're now in our 6th month of living through this pandemic. I wondered if you could kind of give us a sense of what you're seeing, what is life like for the countries that you're supporting, and what are you seeing there?
Yes, thanks. So back in March 2020, when the COVID-19 outbreak hit West and Central Africa region, it further deteriorated the lives of millions of children that were already severely affected by multiple factors in a self-perpetuating cycle. So in West and Central Africa, 24.9 million people are in need of humanitarian assistance today. Of them, 9.4, which means 1 out of 3 are children. 10 millions of people are directly affected by the conflict. And each country of West and Central Africa is some way affected by conflicts. while the main hotbeds are DRC, Cameroon, Chad, the Sahel. We actually used to have two hotbeds, the Lake Chad crisis and the Central Sahel crisis, and now these two have merged into one. We also have battling since a very long time with food crisis that is now worsened by climate change. We have now 12 million people that are food insecure, and 1.6 million children that are severely malnourished. There is political instability, and many countries in the region are ranking very low in human rights and human development indexes. And Western Central Africa is really one of the toughest places in the world to be a child, and especially a girl. So on the onset of the pandemic, the governments in the region took a number of measures aimed at containing the spreading of the virus. School closure, partial lockdown, restrictions of movements, including external borders, a stop to many non-essential services, which has meant in some cases shutdown of all public services with the exception of health services and law enforcement. These measures fail to take in consideration the implication for vulnerable people like boys and girls. Hence, Save the Children in Western Central Africa chose to adapt its ongoing programs and also to fundraise to target not only the children that were already in dire need of assistance, like children affected by conflict and children victims of trafficking, but also children that were made vulnerable by those measures. Children that were left out of schools, that were at risk of domestic violence, and was forms of child labor, just like Amy mentioned, because so many families has lost their income. So we also have chosen to prioritize mental health supports and the protection of girls. But we also knew that we needed to be innovative if we wanted to be effective, because this is indeed an unprecedented situation. So for example, in Niger, a 15-year-old girl that we are going to call Emma for the purpose of this call was attending our accelerated learning program, and she also had access to the school canteen thanks to that program. Emma had previously dropped out of school because her family had to flee several times from armed group and insecurity, and they have lost all their possessions. Both parents lost their jobs in the process. When COVID-19 hit Niger, the family of 11 was at their fourth settlement, and they were reliant on a local cash transfer program of 57 USD per month in order to survive. When both the school and the cash transfer program were shut down, the family felt that they had no other option than to cave into the pressure of a distant family member who wanted to marry Emma. Luckily, our staff was checking in on the well-being of children that were enrolled in our program and learned that Emma was in danger. So for several weeks, they visited the family in order to dissuade Emma's father to proceed with the marriage. At 15, it is legal to get married in Niger. So our team knew that they needed to convince the family, but also to offer alternative plans. So they identified some elders and religious leaders in the community who were vocally against child marriage and asked them to encourage Emma's father to call off the marriage. And the marriage was at last called off, and Emma is in the meanwhile attending radio classes, waiting for the school to reopen. Emma's mother hopes that education will break the cycle of poverty of the family and fulfill Emma's dreams to become a public servant. Unfortunately, not all girls out of school have the same successful conclusion. And this is why Save the Children has launched a global campaign that is called Save Our Education for the 1.5 billion children that are currently out of school. To put it in the word of our senior leadership, COVID-19 exacerbates pre-existing gender inequalities, and it intensified the learning crisis faced by girls. The poorest girls are already missing out on remote learning, and they are likely to be least prioritized if a choice has to be made for the return to school. And not getting girls back into education will again mean years of programs undone. Other vulnerable population, like displaced and migrant children, who often fall between the cracks of national education systems, are also at greater risk of being left behind.
Thanks, Amanda. I think that that story that you shared with us is really exemplary of kind of both the, what we're looking at and what we're doing, and it piggybacks on some of what Amy was talking about in terms of the community child protection networks and the work that we do with community members, because it's not just Save the Children staff who's coming in and convincing these families not to marry their children off, right? That's not the typical case here. And you had mentioned, I'll just highlight, it's the community leaders, it's the religious leaders that we're partnering with and really working, hand in hand with in some of those communities to address these issues and really find what is that support network that's going to help that family make the right choice for their child, and also not leave them with other dire choices, right? So it's not just that one choice to leave them with another dire choice. And so it's that wraparound support network that we're giving those families, and like you mentioned, the mental health support, the education support, and it might be that food support. I think one of the things that I heard from both you and from Amy is that that the food crisis is creating such a dire circumstance for these families, and that without food, right? So if we don't even have the money for food, then you really are making, life and death decisions. And so, I don't know, Amy, did you want to reflect on anything Amanda said? We've got some questions, but I didn't know if I wanted to leave you any time to reflect on kind of what Amanda's sharing in West and Central Africa.
I mean, I guess just to reiterate, it was just such great information, and to reiterate that it shows the importance of us to be able to continue to do our work and find innovative solutions and be able to procure equipment and resources that allow our team members and partners to continue to work in these communities, because they know who's at risk and they have the skills to do so. And it is life-saving. Caseworkers, social workers, child protection officers provide life-saving interventions, and they were initially disrupted in the pandemic because social workers weren't around in different places in the world considered essential workers. So I just think those stories that she's sharing is highlighting the importance of this.
Yeah, I think it also brings to life, some very specific examples of what child protection services mean. I know that can be a hard one. So often we'll talk about health services, we'll talk about education services. And so when we start talking about child protection, it's really helpful to get what exactly is that, right? So how do you exactly keep that child safe from being married or being put into an unsafe job on the street or wherever it is. So Amanda, thanks for sharing that example. I'm going to remind people, please ask questions. If there's a question around anything that Amy or Amanda has talked about and you want to hear a little bit more, please let us know. If it's something totally different, but you have that burning question, please put that in as well. I do have some questions that were sent to us previously that I wanted to get in there. So Amanda, I think you touched on this a little bit, but could you just give us a sense around the impact of COVID-19 on communities in conflict? So I think, you shared a lot about what's happening in West and Central Africa, those communities that are in conflict, and Amy as well, if there's another community that you wanted to highlight. But when we're talking about protection specifically, how is it that we're able to work with those families who are fleeing, right? So the family that you spoke of, it's their fourth time, right, going to another settlement. If you wanted to, Amanda, if you could leave people with an idea of how we do that and what the impact is on children in conflict. Is there anything else you would add to that?
Yes, it is a very worrying situation. With the closure of borders, it has become more difficult for families and community to flee across border to force the security that they need. The border passing has also become more dangerous, expensive, and as a result, we are witnessing an increase of the number of smugglers. Children and family are trapped in dangerous areas with little to no access to health, protective, and educational services. They also have no access to justice. We are reported an increase of child recruitment into insurgent groups like Boko Haram. There is also an increase of GBV, gender-based violence cases, including child marriage and sexual gender-based violence. Let's take Burkina, for example. It's a nation of 19 million people. It's roughly the size of the New York state. At the beginning of 2019, it had 183,000 refugees. And now they are hosting 1 million refugees and counting. As we all know, conflicts affects disproportionately children, boys and girls. And since the beginning of the pandemic, our teams have spoken to many children in Burkina in order to understand how the pandemic was affecting their lives. And they have all regretted school closure and said that insecurity and the pandemic were taking a toll on their mental well-being. A child reported a friend being sexually assaulted. And as the insurgents are deliberately targeting health centers and hospitals, along with schools, accessing to emergency health care is very difficult, and it's also dangerous. Burkina is one of the very few countries in West and Central Africa who did not shut down social services. But with the spike of numbers of violence cases and SGBV cases, they cannot absorb all the demand. And so this is why we are setting up local response and prevention networks through the training of volunteer, community members, parents. Even teachers are volunteering that are now out of schools. They are volunteering to serve the community and their children the way that they can. So yeah, this is a little glimpse of what we are doing.
I think it's also an example of how we often talk about, the COVID-19 for many families across the world is an economic crisis. And then, when we look at children living in conflict, it's just the health effects of COVID-19 aren't maybe not the most dangerous thing for them, right? And so it's the impacts of what's shutting down and limiting children in terms of their access to, to regular health services or emergency health services. So that, yeah, it sounds truly desperate. To move on to another question, we had a question come in specifically around domestic violence. So Amy, I'll actually turn over to you for this question. You spoke about the rising rates of violence within the home as income goes down, stress goes up. Can you give us a sense, maybe an example of one of the ways that we're addressing domestic violence in homes? Oh, Amy, I think you're just on mute.
Yes, thanks.
Yeah.
Yes, that is right. We are seeing an increase globally on domestic violence, and that has an impact on women, and it also has an impact on increasing the stress of their children who are witnessing and experiencing that. So some of the things that we're doing to respond or try to mitigate those risks are, first, we at Save the Children do have a large health response, a community health response and contact tracers. So we are training our frontline health staff on how to identify signs of abuse, domestic abuse, and where to refer them to. So that's the first point. And we're also equipping our own healthcare staff, particularly our women healthcare staff who are also at risk of this, on where to find support and what to do. I think that's like the first thing, because that's how we first get knowledge out into the communities. And then the other things that we're doing is, of course, we're setting up the referral. So the referral is when there's an incident or a risk that those people, those women, those children know where to go or where to tell or ask for help. And this is into what I was explaining before, our community caseworkers who are child protection caseworkers or protection caseworkers who are trained on how to talk to and work with domestic abuse survivors, as well as the children who are experiencing that, and the community-based child protection networks. And then on the other side, where we can, but this is just so limited because it takes a lot of resources, and there's already an issue of this in the country that we're working in. But where we can, our community programs are working on responding by linking and helping those women and children connect to other safe environments, either shelters or with extended family members, which is the best response for them. But in this context, it's just extremely difficult and it's resource intensive, and it's also community intensive, and people are becoming more fearful. So that also links to our overall awareness and information and community support.
Thanks. And Amy, this one might be for you as well, looking at kind of a global perspective. So there's a lot of, this person says there must be a lot of logistical challenges with lockdowns and quarantines and social distancing, right? So it's, like I said, it's happening linearly across, it's not happening linearly across the globe, it's happening in waves, and there's different countries experiencing different spikes or no spikes. And so must be incredibly challenging to manage staffing and also keeping our staff safe. So the question is are social workers able to actually get out to families? And so you mentioned before, I think you mentioned before, they are in some instances, and how are they doing that?
Great question. And this is the question that we're asking ourselves every day in child protection at Save the Children. So actually, in the beginning, they weren't. In the beginning of each lockdown, they weren't, because of the guidelines and the protocols, and nobody knew what to do, and they weren't essential workers, and they also have to protect themselves and their families, of course. But it was immediately, though, even though they weren't, or they felt like they couldn't, the social workers themselves were asking for us support at the global level, like, we're worried about our children, we know these children are at risk, how can we access them? So they were requesting and demanding support. So we started working where we could, again, where they would be allowed to access in person, providing them with PPE, providing them with information. So Save the Children has a staff of epidemiologists that are working globally on on infection control and how to keep us all safe, providing them with those skills and knowledge like we did our health workers. But where they couldn't access their children at their homes, or where they weren't allowed to based on local rules, we are providing and working with them to use various platforms to connect. So phone, WhatsApp, where they can Zoom, and those types of things. But they're still in this section, and I mean, we can hear from Amanda because she works with so many low resource, low tech situations. This is still an ongoing area that we are working on, and we are also working on, so we continue to be able to respond and are ready to respond to the next one. But how do you actually connect and communicate to a child who's at risk in their home when you can't actually see them in person? So we have some innovations going on and some good practices, and we're continuing to work on that. So I'm not sure, Amanda, do you have anything to add specifically?
Yeah.
So each and every each and every community is has its own stories and ways we need to connect to be really effective. But I think that we use a lot in Western Central Africa. We use a lot radio stations, radio programs. We have also provided radio to communities that, especially refugee and displaced communities that did not even have radios in their households. So we have given them these radios because then they could listen to our radio programs and maybe call back. In Senegal, we have set up, with the help of a local partner, a sort of line that functioned with text messages, and it has worked very well. So we are trying to be innovative and creative, and we try to find every way possible to reach out to children and their families.
I think time and time again, when I talk to folks working across the globe, I mean, the radio just keeps coming up over and over and over again, whether it's health, right? So health messages going out by radio, education, same thing. Our education programs are going out over radio. Amy, you mentioned stress busters, right? So I think I've heard the ones in Uganda. And I think we actually played one of the stress busters on our last webinar.
Oh, nice.
And yeah, and the one in Uganda, I mean, they're fantastic. And they're really engaging, and they're just great. But I think what's striking is, in the day and age where we talk about technology and innovation, and then sometimes it is not high tech, right? It's how do you reach the most vulnerable, right? So that's really where we're focusing on, is the most vulnerable of these families who don't have resources and may not have a phone, or like you said, Amanda, don't have a radio. And so radios have been, it seems like, the technology of choice right now, in working in COVID environment. So that's really interesting. And I'll ask one more question, because everybody's time is tight, and so I want to make sure that we get to all the questions. But there's a question again on ending early marriage. So Amanda, you had talked about early marriage in the story, and I think it was a really great example. But the question here is, what kind of interventions really work? And so I think, again, like, this is a really hard one to understand. How do you stop that when that choice is so challenging, and how do we work with families? It seems like a very, very delicate situation to have to insert yourself in a family and deal with that.
Indeed, just like Amy said, child marriage is a complex issue that requires a multi-level approach. Key to prevent child marriage is addressing the root causes embedded in local culture and tradition. So we need to know what are those keys. And after so many years of collective work in collaboration with other agencies and agents of change, we now have a number of traditional and religious leaders in the community who can champion the end of child marriage, both within the community and at national level. Those allies are critically important, as we said before, because it is essential to show the community that there is a debate from within, that many respected members of their own community are debating about the issue, and there is no monolithic position on their side. There is a debate, and it's not an imported debate from the north or the west. We also work on the agency of the child, to make sure that there is a space for them to have this say on all the matters and the decisions that impact on their lives. And also that he or she has plans for her future, and she's in the condition to pursue her plans. Through positive parenting, we also address, toxic social models within the society and try to challenge them. But I think that the one key element that is very effective in West and Central Africa is school. We have peer-to-peer programs from pre-adolescence so on, but we really address the issue of early child marriage within the school, but also through the educational process. We make sure that the child has all the skills to succeed in life. And then there is also parallel work that is done with governments to ensure that the right laws are in place and they are executed. And to be honest, we have witnessed a number of momentums on child marriage in West and Central Africa, where governments were endorsing and taking the lead and really showing their engagement in ending child marriage. However, with the effect of COVID-19, we risk a setback. But it's a challenge, but it's also an opportunity, and we are really trying to gather all our resources to make the best of this out of this very delicate moment.
Yeah, it does seem that COVID-19 is putting in place kind of all the barriers at which we were trying to address pre-COVID, and it's just knocked us down in terms of the work that we have been working on for years. So what, the financial aspect of COVID-19 and really taking a community who may have been moving along and trying to get their girls to go to school and stay in school, and now we've been knocked back, and they've just been challenged by this. So it sounds incredibly challenging, and I wish you like all the best in keeping at that. Amy, did you want to say anything about any other areas of the world in terms of what you're seeing with ending child marriage? Or
No, just the same issues that Amanda was talking about are what we see globally. And then it is true, this crisis, which is unprecedented and is what we see in other crises of what you mentioned, Amanda, that all of those things that Amanda is talking about is exacerbated by crisis and the socioeconomic effect on the crisis. So sometimes we even see families resorting to marrying girls younger because they have no options. So that's absolutely what we see globally, and it's contextualized the response.
Yeah.
But the other note, children are incredibly resilient, families are incredibly resilient, communities are incredibly resilient. So, we're working fast and we're all working around the clock because what you said, setting back the work, the gains that we made in the past 100 years on protecting children and violence reduction, we don't want that to go backwards. So we're working hard against that exact thing.
Okay. Well, I just want to be cautious of time. It's 3:47, and I'm not seeing other questions right now. So I'm going to just take this moment, just again, to thank you, Amy and Amanda. I know, like you said, Amy, you're working around the clock, and I'd attest to that, to seeing the emails that come through late at night, and the work that I know that folks are doing out there globally. So thank you for taking a moment in the day to speak to me and to share a little bit with our supporters, and to get some insight on where we are with COVID-19, but also what we're doing with the support that we're receiving. I'd have to say that it is through the supporters that we've been able to pivot quite quickly and adjust our programming. So that innovation and that addressing the new challenges and how do we work with this now, or how do we get folks out now? The PPE you mentioned, how do we purchase that? That really is thanks to our private donors. And I think folks should know that public funding has become available for COVID, but it takes a long time to come through. And so it is through private support and individual donors that we are able to work quickly. And so Amy, you referenced that working quickly. And so folks on the line today, I just wanna thank you for your support. There is so much more we could talk about in terms of child protection. I think that's going to be it for today. If you have questions, please reach out, keep the conversation going. We love to answer your questions. Don't hesitate to reach out. I just want to leave you with one sense of inspiration and hope. I don't want to end on a sad note, because we see lots of dire predictions and really hard stories in the news every day. And so, Amanda, I hope I'm not putting you on the spot, but can you just give us a little bit of what is something you've seen? What are you experiencing? What do you turn to when you're feeling like, wow, this is really hard, and what gives you hope for children?
Thanks. I think children themselves. When we were on the onset of the crisis, and school were just shut down, and we were trying to understand what was going on, children took the lead. They called us up. In Nigeria, they called up our green line, and they said, I'm not well, and I know that Save the Children can help me. And they were sharing stories with us, and they were trying to reach out for some consolation and some support. And this is, give me the sense on how Save the Children has means in the lives of these children. And this is what, not just me, but everyone in the country office at field level turns into when, hopes are a little bit and spirits are a little bit low. But the children cannot be let down.
No, thank you. I think that's another part of what we do is we help children find their voice, and then we give them the avenues to use it. Amy, do you want to leave us with anything as well? Anything that you turn to?
I think that was a perfect way to end it.
Yeah, I do too.
Yeah.
All right, Amy, Amanda, thank you so much for speaking with us today. Again, if anyone has any questions, please reach out. I think you all have members and staff at Save the Children that you have their email addresses. We will be reaching out to you. We'll be sharing the recording of this webinar. We'll also probably be sharing, Amy, I believe you referenced a study that we've done. We'll be sharing that report. So if you're interested in more in what we're seeing, some of the statistics that we're seeing around what's happening to children, that will be in your inbox. We also have some articles on ending child marriage. We'll link those in there as well. So Amanda, thanks for sharing, and everyone have a great afternoon. Thanks so much for joining us. Bye-bye.
Thank you.
Thank you.